So I probably am preaching to the choir here, but I can't help myself when I get up in the beginning of one of these to talk a little bit about why we as a department and professionally and personally, we are so completely dedicated to helping people achieve competitive employment. And then we will talk about the intersection of these two things, which is so important. We think we're still doing a terrible job at it. As government, we personally feel very responsible for the failings of our system and are really, really working to try to be creative and innovative and think of new ways to approach this problem. Because let's face it, the numbers are abysmal, and I'll highlight some of those and sort of tell you how we're trying to move them. And finally, I'll talk a little bit about some of the policy level interventions. So what are the big, big things we can do to affect millions of people, not just the one by one services we deliver, which are very, very important every day, and we want to address it at both levels. This is something we talk about all the time in our department, the terrible result of the fact that when you get ill in this country, if you develop a serious mental illness, you are more likely than not to end up in poverty. Being sick should not make you poor, but it does. We hope that there's a lot of opportunity for improving that with healthcare reform and a lot of things on the horizon, but we have a long way to go. Unfortunately, people with mental illness are 3 to 5 times likely as other people to be unemployed. And when you have a serious mental illness, that goes up to almost 90%. And that's embarrassing as a community, as government. I think that's something we all need to take personal responsibility for. 70% of people with a serious mental illness who have a college degree currently earn less than $10 an hour. And 1/3 to 1/2 live at or below the poverty line. And the impact, we all know these things, but the impact is far beyond the personal. We care deeply about the personal, about every individual's quality of life, but there's also a systemic impact, an economic impact. There's tax revenue, there's expensive services that are utilized, shelters, people ending up in jail, all these things that we know happen when people are not engaged in recovery. And I couldn't have said it better than my colleagues. It was really wonderful to hear them talk about the fact that we concur completely that everyone can work. We surveyed our folks recently, I guess in the last 2 years, just a sort of subset of the people we serve, and 80% of them said they wanted to work today. Today, they would take a job if they could get one today. So when I hear people say, oh, these people are too sick to work, I sort of cringe, and I think, if we could build systems to support them and change policies that take away their benefits or impact them from doing so, I think it would be 100%. And that 20%, as you said, who won't come to you, or the 80% who doesn't start coming to you or say they want it today, with the right supports and encouragement and engagement, will all say eventually we want to work. My grandfather was one of the first people who really gave me some insight into this. He's no longer with us, but when I was very young, he was a steel worker. And he was laid off from Bethlehem Steel, my hometown. And he, fumbled around for some odd jobs for a while. He had 3 daughters. Was a bartender, a delivery man, working, shift after shift. And eventually he ended up at Goodwill Industries. I don't know if we have anybody here from there, but it's a wonderful organization that I was introduced to at a very young age. And his job was to help do job development, to help people with disabilities find jobs that they could do. I mean, this is decades ago, so clearly we've come a long way from them. But even then, he came home one day and told me a story about a woman who was blind and deaf. And she had been bounced around to a number of programs. She wanted deeply and desperately to work. And everyone had sort of given up on her. They didn't, what could this woman do? No one knew how to help her. So he spent a little extra time with her. He got to know her. But in my hometown, there's one of these companies that builds the toilet paper holders, the things in the middle, the spring-loaded that hold the toilet paper. And so he talked to that company, and he got boxes of the pieces of this toilet paper holder sent to his office. And he sat with her, and he took her hands, and he moved them across the boxes, putting each piece together with her. And he did this for hours, days, until she could do it herself. And after several days, he came into his office, and she had gotten there before him, and she was sitting there putting them together with the biggest smile on her face, pile of these things already put together. She was the fastest toilet paper holder putter together that the company had ever had. And that story just will always stick with me. It inspires and motivates me. Anyone can work. People really do feel a different sense of fulfillment in their lives when they can do that. So this is where we get into supportive housing. So you all know this. I'm not going to read through all the wonderful things that supportive housing can do to help people with their recovery, integration, independence. But, and unfortunately, it's at the bottom there, but a lot of what's missing, and this isn't because people don't want to do it, it's because it wasn't really truly built into some of the initial programming and funding and financing of these housing units, that we did not, integrate very good supports for vocational development and educational development, and now we're trying to change that. And it's a really big ship to turn, and it takes a long time, but with programs like Jericho Project and our collaborators and programs, we really believe that we can slowly and truly integrate vocational supports into every program. This is our failing. This is, you can see, hopefully, and if not, I'm happy to share these charts with folks. This is as of this year. This is first quarter of 2013. The big green bars, just so you can see those, that's all the people in housing. And it's just broken up into different age ranges. So, it starts with your youngest group of 18 to 26 and goes up to, your group on the far right is 53 to 69. Now, first of all, that's a profound picture. The impact of our supportive housing folks, almost 50% are in the age range of 53 to 69. And that's going to be a whole nother challenge we're going to be facing. Of people aging in place in our supportive housing. But the bars so you have the green bars are all the people in housing, and the tiny little bars that you can barely see in blue and red next to them are people working. That picture motivates me. And you can see on the right, I'm just showing you, there's about 4% people are employed part-time, 4% full-time, 10% are in vocational programs, 22% are of retirement age. So still less than half. There's more than 60% of people who are none of the above, and that's not acceptable. So we're doing a few things. We're trying to improve this, but we have ACE. Do I have anybody who works in an ACE program? Hi, one. We think these programs are wonderful. Supported employment is an evidence-based practice put out by the Federal Substance Abuse and Mental Health Services Administration, SAMHSA. It's the thing that is supposed to work with people. They have approximately 40 to 50% success placement rates in New York City, which is very good for employment programs. We would love to do even better than that. And we are talking a lot with them about integrating their work and partnering more with our supportive housing providers and thinking through creative ways to do that. So we're helping and reaching people. Training. We do tons of training. And we're training everybody on employment, Medicaid buy-in, criminal justice issues, how to help people clean up rap sheets, vocational assessments, helping programs hook into the statewide employment services system so they can leverage federal funding for Ticket to Work and other resources. And we have economic self-sufficiency forums. We have one coming up in June. But we do half-day forums where we invite everybody from every level of government, from SSI, from the IRS, from banks, to talk about IDA, asset development, benefits issues, tax issues for people. We have people who are willing to do taxes for free for people, earned income tax credit consultations. So we're really trying to build a sort of culture change around knowledge and understanding and fiscal literacy. And then we're emphasizing this in every program that we fund. We ask them how many people are employed every quarter. So whether it's a clubhouse, people know that, a support program, whether it's a housing program, whether it's any program, our ACT programs, our case management programs, every one of them is being counted every quarter, how many people they're getting to work. If you're not getting people to work, we're going to pay somebody else who is. Quite frankly, the government has to be accountable for the taxpayer dollars. We have to be good stewards of that. And if we're not demonstrating outcomes for those dollars, then we've got to get them to somebody who can do it. Because there are people out there who can do it. There are providers out there who are doing this work. And we're emphasizing peers in every aspect of our system, people with lived experience who have gone through the system. and I can talk more about that. The panel right before this, if you were here in this room, Jamie Nichols, who works with me, did a great presentation on our new parachute program. We're hiring, we've already hired over 30 peers in the last few months. We're hiring more every day. And of course, improving the policy landscape. But none of this is enough, and we're going to talk about, move quickly through why. This is just a quick snapshot to show you, sort of look through the other way, supported employment, how many of those people are living in supportive housing. 40%, the big blue chunk on the right, is people living in supportive housing who are served by our ACE programs, which is around 1,000. With the family members, the red at the bottom, and on the left is independently. So we do have people who are living out there in public housing, and so I'm always amazed that people can do that. These are our successes. People are working. People always, I hear, oh, well, people can only work, they take these entry-level jobs, they do. This is every walk of life, all the different types of work, education, messengering, horticulture, security, maintenance, retail sales, peer advocacy, health-related, food service. These are all the diverse places that the people that we're placing are working. So this is the final really important thing I'm going to say. Our policy landscape does not support this work. Many of you who are doing it in spite humongous obstacles, both for yourselves in doing the work and the people you serve. And we're very aware of that, and we're deeply committed. As a public health agency, as the City Department of Health and Mental Hygiene, part of what our commissioner asks us every day is, these programs are great, we're churning through, we're really trying to improve them, we're getting more people to work, we're getting more people housed every day, but it's one by one by one by one. How do we change the landscape so that millions of people can go to work? Thousands, hundreds of thousands of people with mental illness across the country, across New York City can go to work. What are the real, true barriers to people going to work? And we all know them. You probably know them, even better than I do and see them every day. But our programs, unfortunately, many of them are not built to catch people until they're already in trouble. Eviction. We need more eviction prevention, more prevention in general. We're working to identify young people earlier and earlier in their illness. We're going to be piloting some work that's really focused on what we call first episode, but identifying young people as they're becoming ill and catching them immediately and grabbing them hard and linking them to services, engaging them and supporting them very early so that they will be able to not go down the spiral and the trajectory, unfortunately, that chronic illness frequently takes them. We also know, I know this is a supportive housing conference, more or less, but we also know we can't possibly build enough supportive housing to keep everybody housed that needs to be housed. We can't keep up with the demand. It takes too long, it's too expensive, it's just not possible to do it fast enough. So we need other solutions. We need access to affordable housing for people with mental illness and other disabilities. So we're really excited. We're starting to pilot a program where we're going to do set-asides in affordable housing buildings that are coming up in New York City for people with disabilities and mental illness. So look out for that in the coming months. We've got the first few projects that are sort of beginning. Keep your eyes open. And then this is our picture. This is our framework. We are deeply committed to changing SSI to be more flexible and nimble. We think it's a problem. We're going to be talking a lot with people. So, changing SSI, looking at ways to make benefits more flexible and nimble. Robert is on our consumer advisory board, and he asked me to just mention this briefly as a close. Robert is a peer. We have a consumer advisory board that we meet with every month in our department to tell us what we're doing wrong. They love telling us what we're doing wrong. And what we're doing right. Hopefully, they do say that sometimes. And how do we make it better as government? And so Robert was telling me that he got a job. Pretty decent job. He liked the job. He was making $10 an hour, working 21 hours a week. He started going to work. And Robert ended up with very little money in his pocket because after transportation and taxes and the increase in income that he had to pay towards his rent and the loss of benefits, so he had to now spend down to get into Medicaid, and that he ended up with just almost pennies a day more than what he would have had if he hadn't gone to work. How can we ask people to go to work if that's what they're ending up with? So there are tools, there are ways. We're building toolkits so people understand benefits, the spend down, the buy-in, the IDA, the asset development, all these things that people can do so that they can keep more of their income when they go, but it's incredibly difficult to navigate. So if people are interested in toolkits and trainings for your providers, for your organization, I would be happy to connect you to the resources we have. We sort of swept away, we got very lucky, Olga Ivnitsky. I don't know if anyone knows her. She used to run the WIPA here in New York City. She now is our employment coordinator, and this is her only job in our department, is to get more people to work and to help you and support you in getting more people to work. She will come out to your provider organization. She will do trainings for you. She's building toolkits. She knows more about benefits than I think anyone on our staff will ever know combined. She's incredibly insightful and thoughtful about that, and she will be an asset and a resource to us. So I encourage you to ask questions and let us know what we can do to help.